Hi everyone. So today we're going to talk about the trends in healthcare expenses and the different types of methods that we have to pay for those expenses. Healthcare costs have been a controversial topic for years now, even after the passing of the Affordable Care Act and the expansion of insurance coverage. The growth in costs did slow down after the initiation of these two things. But Elizabeth Freeberg talks about in her book how US spends more than any other developed country on healthcare and still doesn't achieve better health benchmarks. Freeberg uses life expectancy as her example. Life expectancy numbers for both males and females are lower in the US than those in developed countries. In an article by Sherry Glide in Benjamin Zoo, a study showed that hospital stays were the highest expenses in healthcare, followed by physician expensive. Freeberg discussed another study in her book where a percentage of Americans reported difficulties affording the premiums and the co-payments. They also report cutting back on necessities such as food and clothing. They talk about delaying and skipping visits and not even filling prescriptions due to the high out-of-pocket pay for healthcare. So what are the different payment methods and how have Americans tried to overcome this high out-of-pocket expense of healthcare? The first method we're going to talk about is out-of-pocket payment. This may be thought as the simplest form of payment, but definitely not the most feasible for most. The consumer directly pays the provider for the care. While some may still utilize this method, today's healthcare is just too expensive, and ultimately to afford this pay is just not doable for most. The second method is private individual insurance. In addition to the consumer and provider, this method adds a third party called the insurance company. The consumer pays a premium to the insurance company and then also pays the provider upfront. The insurance company then makes a reimbursement payment to the consumer. So this type of method still requires an individual to come up with usually a large out-of-pocket amount to pay the provider in one setting, which is ideally tough for most. The next type of insurance is employee-sponsored group insurance. This is probably the most popular. This has became a benefit for working individuals offered through their employment. So basically, the employer pays most of the premium to buy the insurance and then covers a large percentage of the expenses for the individual's healthcare visits and prescriptions. The consumer is responsible for co-payment and deductibles that are usually practical in cost. Freeberg explains that this insurance is treated as a tax-deductible business expense for the employees. The last type of insurance is public or government-sponsored insurance. Freeberg discusses this method started back during the Great Depression. There was a large percentage of individuals not working. For example, the elderly and chronically ill individuals, they weren't able to qualify for the employee-sponsored insurance, and paying out of pocket wasn't feasible for them. So the government created Medicare and Medicaid programs for this group of individuals. This method does, however, add the taxpayers into the equation because they are ultimately the main payer, meaning these programs are ran by taxpayers' contributions. This method is widely used today by elderly and the individuals with chronic illnesses. Healthcare has came a long way with payment options. We've seen that the out-of-pocket method has basically dissipated due to people not being able to afford it. The other methods are still widely utilized, especially the employee group sponsored and the government sponsored insurance. Even after expansion on insurance coverage, Americans are still spending a lot of out-of-pocket pay on healthcare, and it continues to be a burden for many to afford this. Thank you.